Bleeding in urine is never normal. Somebody could bleed in the beginning of urination, somebody could bleed at the end of urination, or somebody could be bleeding across the entire urinary period. That means his beginning to end of urination is all mixed with blood. There could be bleeding where you could have some clots in urine, or there could be some bleeding which you cannot see, and it is called as microscopic hematuria. So remember, bleeding in urine is never normal. If you ever have bleeding in urine, then you would not wait for things to worsen. It's a wake-up call that there's something wrong happening there. It's not because of summer season or because of drinking less water. It has a reason. Urinary infections can cause bleeding in urine when they're very severe infection. Normally, urinary infection comes with burning and discomfort, maybe some frequency, some urgency, some stranglery aspects which actually trouble you. You may go very frequently, you may have pain, discomfort while passing urine, sometimes all through, and sometimes it could possibly land up with fever and ascending pyelonephritis or infection that is spreading to the body and the kidneys. So infection causing bleeding must be a serious infection too. But commoner causes of bleeding at all age groups are stones, and stones in urine form in the kidney. So if you have got a stone-related bleeding in urine, you possibly could have a pain in one of the flanks, and the pain could be going down. Along with that, you see bleeding in urine. That's a possibility. But let's talk about elderly people in their 50s to 80s who come in around to a urologist across the country, and they are having bleeding in urine. So the common causes of people in that age group of 50s to 80s who have got bleeding in urine are, number one, again, a stone, which could be a common issue. And the other is prostate. As prostate grows in size, something that you measure in an ultrasound and sometimes get worried, which is a hormone-related change that is happening in prostate. Its blood supply also increases. And that increase in blood supply could sometimes cause a spontaneous bleeding when you're straining to pass urine or when you're constipated. So spontaneous or without any reason bleeding in urination, especially in very beginning or very end of urination, could be related to an elderly gentleman straining to pass urine or the prostate having outgrown its blood supply as really waiting to bleed. So that's an important aspect which sometimes they miss out. Let's not forget that many people in that age group also undergo angioplasty and cardiac bypass. That means they are on blood thinners. People could be on blood thinners also because of neurological reasons. And blood thinners are those which could cause bleeding from a susceptible lesion or a susceptible organ. For example, if you are bleeding in urine from one of the sides in the kidneys, it could also be bleeding because of tumor and cancer. So bleeding in urine is never normal. If you had mild bleeding in urine and it did not trouble you too much and you forgot about it, don't let it be there. It should be taken to a logical conclusion. So all bleeding in urine, either microscopic bleeding, which is only visible in the urine reports, or macroscopic bleeding, which is visible to you and you worried about it, which is in the early part of urination or the whole urine is mixed with blood or only the last part is bleeding, has a cause. And the common causes, as I said, are stones, cancers, and sometimes very severe infection. There could be no third or major reason. Obviously, there are nephrological causes of bleeding where bleeding can happen from the kidneys, and we need to assess that. Those bleedings are more microscopic than macroscopic. So if somebody has got visible bleeding in urine, there's almost always a urological cause, and the cause could be ascertained by an evaluation by a urologist. In the history that he takes, in the kind of evaluation with a sonography or a CT scan that he does, he picks up the causes which is important for him to logically take it forward. For example, smokers bleeding in urine could be related directly to a possible cancer of the bladder or cancer of the kidneys. So smokers are prone towards cancerous changes happening in multiple organs in the body. And therefore, smoking is a quit all the time. In other words, these are aspects which bring about progressive changes of carcinogenesis in various organ systems. Bleeding of microscopic kind, which you see continuously happening in all the urine reports, needs to be evaluated. But that evaluation should be left to a urologist because his job is to look at examining you after having talked to you and looked at the findings and prevents you from anything bigger. In other words, waiting for trouble to happen with a minimal bleeding in the beginning and suddenly you come with a very significant bleeding in the end, which could be one day emergency with clot formations, etc., is completely preventable. As elderly people get into angioplasties and into angiographies and bypass, and they're on blood thinners for a long time, they're always prone to some kind of bleeding. If there are foreign bodies inside, like the stones or stent or catheters, bleeding is a possibility. So let's look at the face value of an alarming situation which you encounter one day. Any bleeding in urine is never normal. Children could have bleeding, elderly could have bleeding, bleeding could happen at any age group. For any bleeding to be treated and taken forward to a logical conclusion of a cure, one needs to identify the cause. And the causes are obtained. The common causes in an epidemiological situation is more related to stones, severe infections, and cancers. So all bleeding in urine should be taken to a logical conclusion by evaluating with an ultrasound, by evaluating with a CT scan, sometimes by a cystoscopy, taking a look inside with a telescope, or sometimes with a ureteroscopy and a flexible ureteroscopy. So if you ever had bleeding in urine, and if you are on blood thinners, they will sometimes stop your blood thinners for a few days to look at it, get it sorted out. And similar situations where sometimes a post-surgical bleeding happens. If you underwent a surgery a few weeks to few months ago and you bleed now, either the healing has not happened or there are aspects which need to be looked at. And therefore, your urologist is best to identify that for you. So don't take bleeding lightly in urine. There's another bleeding which can happen in men where they get up and find their undergarments are wet with blood. They get up in the morning and find some bleeding in the undergarments. Now, that's a different kind of bleeding, which is called as urethroragia. That means bleeding has come not from the kidneys or the bladder, but from the urethra, which is a male organ through which the urinary passage has bled, but that is beyond the sphincteric control, and therefore the undergarments have gone wet. There's another bleeding which we know, which is called as hematospermia. That means bleeding in the semen. And the patient gets very alarmed, having looked at there is a sudden onset bleeding yesterday night. Next day morning, he is across the table to me here, looking at why did the bleeding happen. So hematospermia or bleeding in semen can sometimes be seen and can be a recurrent affair. All bleeding have a cause when it's coming from the urinary tract. The worries are sometimes it could be a cancerous change from the kidney, from the ureter, from the bladder, from the prostate, and we need to evaluate that in time. So next time, if anybody had bleeding in urine, you happen to be an ambassador to look at, not leave it unconquered or uninvestigated. An investigation to a logical conclusion of identifying the cause and taking it forward towards a therapy and cure is an intention that we need to take forward.